Okay, it's 6 o'clock, so we'll go ahead and begin. Welcome, everyone, to the Dayton VA Medical Center's Healthy Choice webinar. We're thrilled to have so many participants on today's session. I want to start by saying this event is being recorded, so if there's something you missed or later want to rewatch, you'll be able to do that. We'll be sending you a link to that recording after the event. You can also share that link with anyone you feel may benefit from the information we are sharing here tonight. I am Scott Leese with the Community Outreach Office at the Medical Center. I am an Air Force veteran, and like many of you, once had many questions about VA healthcare. Let's see if we can answer your questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar. We had 131 register for this event, so this is why we are keeping everyone muted. Again, this is simply to ensure that there isn't an excess of distracted noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane on the bottom right of your screen. Simply type in your question, and one of the presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of this presentation. Again, there's a lot of folks on this evening, so again, we hope you understand why we have you muted, but please feel free to enter any questions or concerns into the chat pane. Now I'd like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to your Dayton VA Medical Center.
Hi, I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose has not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
And thank you, Mr. Murdoch. While we have a long history of veteran care here in Dayton, this year marks the 75th anniversary of our modern Veterans Administration. We are proud not only to be one of the oldest campuses as part of the VA, but also boast one of the newest and most modern medical facilities offering top quality care to our veterans. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation today. And that's also top rated by the vets who it serves with a more than 98% satisfaction rating. This is a benefit that not everyone is able to receive. This is only available to veterans. Well, that's one of the reasons we're here tonight. For those who are not enrolled with the VA, we hope that you take an opportunity to do that right now. It is easy. One way is to visit the Dayton VA Medical Center and stop by the Enrollment and Eligibility Office. They will be glad to help you walk through the process. You may want to call first to make an appointment. They'll be glad to schedule an appointment if you call, and you can reach them at 937-268-6511, extension 5336. Again, that number is 937-268-6511, 5336. At that time, they'll tell you what documents you need to bring so that they can help you determine the eligibility. For the tech savvy, you can also enroll online at www.va.gov. Veterans may also reach the National Call Center at 877-222-8387. And finally, veterans may mail an application directly to the Dayton VA Medical Center. We're going to provide this information again later on in the presentation. You can also enroll in person at the surrounding community-based outpatient clinics, also known as CBOCs. They are located in Lima, Middletown, Richmond, and Springfield. And again, we'll share that information later on. So if you don't have pad and pencil handy, you might want to get that before the end of the presentation. So one of the reasons we're here tonight is so that we can hear from our subject matter expert who can tell us more about how veterans can receive vital benefits from the VA, specifically the VA's nutrition service and how we can all make healthier choices.
Good evening. My name is Lisa Sharp Gomez, and I'm one of the 15 registered dietitian nutritionists in the Nutrition and Food Service Department at the Dayton VA Medical Center. We're honored to serve our veterans by providing excellent nutrition-related care at the Dayton VA Medical Center and to provide nutrition, education, and interventions that promote health throughout multiple life stages. Our mission is to support veterans in achieving their health goals. At the Dayton VA, we strive to provide veterans with a continuum of care that is accessible, value-added, cost-effective, and of the highest quality within an environment of outstanding education and research. We're committed to providing the best quality customer service to improve the health and satisfaction of our veterans and their families. We employ a staff of 75 ServSafe certified food service employees who prepared and delivered more than 370,000 meals last year. A skilled administrative staff utilizing advanced nutritional software ensures that all meals provided to our veterans are nutritionally balanced to promote health and healing and accommodate special diets and needs. While no one wants to or plans to be admitted to the hospital, our dietitians provide nutrition-related care in all inpatient areas, including medical, surgical, renal, and enteral and parenteral nutrition support. Nutrition care and education is also provided for our veteran residents in the inpatient rehabilitation unit, the community living center, hospice, and the residential rehabilitation treatment program. For those veterans who are long-term residents in the community living center, options for variety include the Splendid Table program, which offers special treats throughout the month. Special meals are offered in honor of veteran residents' birthdays and for holidays. Residents were honored with a steak dinner this past Veterans Day. Super Bowl Sunday was recognized with a bratwurst meal for lunch and wings for dinner. For veterans who are part of the residential rehabilitation treatment program, meals are provided at Heroes Cafe. Meals are served cafeteria style with an option for entrees and sides. Grab-and-go items are available and many special meals are served. So that's some of the great information about the inpatient care provided. Now let's talk about what's available to outpatients. Registered dietitian nutritionists are part of the patient-aligned care team or PACT teams in the outpatient clinics at the Dayton facility and at all community-based outpatient clinics. Education and support are provided for diabetes, cardiovascular conditions, oncology, weight loss or weight gain, and home tube feeding, to name a few. Dietitians utilize a nutrition-focused physical exam to assess a veteran's nutritional status and to provide individualized education to help veterans achieve their health goals. A registered dietitian nutritionist is also part of the care team for those veterans receiving dialysis as treatment for kidney disease. As diabetes is a health concern among our veteran population, a certified diabetes educator is available for classes and individual appointments to assist those veterans with diabetes in achieving healthy blood glucose levels and managing medications, along with providing education on a healthy diet. Outpatient appointments can be conducted through a variety of methods. Face-to-face visits were the standard pre-COVID, but COVID precautions allowed us to creatively expand our appointments to phone and virtual platforms using the secure VA video platform called Veterans Video Connect, or VVC. VVC is much like Zoom or FaceTime, allowing the veteran to connect with a dietitian from the comfort of home. Telehealth is another video option to meet one-on-one with a veteran. For those veterans who may not have technology or equipment available at their homes, telehealth enables a veteran to receive virtual face-to-face care with one of the Dayton VA dietitians from the CBOC where the veteran receives care. So how do veterans make an appointment to see an outpatient dietitian? It's a very easy process and can be accomplished in one of two ways. The first way is that a provider can place a consult and the veteran will be contacted to schedule an appointment. Secondly, a veteran can contact our scheduler directly by calling 937-268-6511, extension 1001. The scheduler will help the veteran select the type of appointment, whether individual or a class, at a time that will work for the veteran. And speaking of classes can be an effective way for VA dietitians to provide information. Due to COVID precautions, classes are currently provided in two formats, by phone and virtually. Class offerings include Diabetes Basic Education class, which is designed to provide nutrition education to those veterans newly diagnosed with prediabetes or diabetes. The Diabetes Self-Management Education is an American Diabetes Association accredited, evidence-based, 4-part series led by our certified diabetes educator, and it empowers veterans to gain control of their blood glucose, medications, and diets. A registered dietitian nutritionist also works closely with the mental health team to provide nutrition-related educational classes for veterans as part of the curriculum in the Residential Rehabilitation Treatment Program. This includes healthy nutrition classes and individual nutrition appointments. Another very important series of classes offered at the Dayton VA is the MOVE program. MOVE is a national, VA-developed, evidence-based, no-cost health promotion program designed to assist veterans with developing healthier habits. Healthy lifestyle can help reduce the risk of developing certain diseases, may aid in the reversal of certain diseases, and can improve the quality of life. MOVE is a 16-week series of classes that are led by dietitians and other medical professionals. These classes support veterans in their efforts to make healthier eating, healthier exercise, and healthier lifestyle choices. The curriculum was developed to provide the tools to allow veterans to take control of their health and weight. Each class addresses a different topic and encourages veteran participation to set achievable goals and learn problem-solving techniques. This is a special opportunity for veterans to share with others who have similar goals and experiences. Why was the MOVE program developed? Over the years, the number of veterans receiving care at VA facilities considered to have overweight or obesity has increased. Approximately 45% of veterans enrolled with the Veterans Health Administration nationwide are overweight or obese. Overweight and obesity increases the risk of developing certain diseases like diabetes, hypertension, cardiac conditions, some cancers, and sleep apnea. Veterans are screened yearly for overweight and obesity, and if desired, can be referred to the MOVE program. Enrolled veterans may also call MOVE directly at 937-268-6511, extension 1699, to enroll themselves. Several options are offered for these health-promoting classes. Pre-COVID, classes were held in person at the Dayton VA and at all community-based outpatient clinics. Currently, classes are being offered virtually through the VVC platform and are offered on a variety of days and times. If a veteran is interested in learning about lifestyle and diet modifications to manage health and weight, but is unable to attend a class, individual MOVE sessions can be scheduled by phone or video to provide information and coaching. As we all have preferred ways of learning, some veterans may desire a more independent approach to health and weight management. The TeleMove program could be a good fit for them. This program is the same curriculum as the 16-week MOVE program, but is broken down into short lessons presented on a daily basis through an automated phone call. The veteran is provided with class materials and a scale and is prompted by phone to interact with recorded lessons. This program is administered by nursing, not nutrition and food services, and dietitians do not participate in the lessons. However, any veteran participating in the TeleMove program may schedule an appointment with one of the outpatient dietitians for additional information, education, and support. In order to participate in this program, a consult must be placed by the primary care provider. The point of contact for information is Barry Holt at 937-268-6511, extension 3467. Offered alongside MOVE is BAM, or Be Active and Move, aimed at those veterans who want to safely increase their physical activity. For those veterans who have completed the MOVE program, MOVE Maintenance provides continued weekly support as desired. Many veterans enjoy the opportunity to check in and discuss weekly successes and challenges. A favorite class at the Dayton VA is the Healthy Teaching Kitchen program. VA dietitians demonstrate recipes and introduce veterans to healthful cooking techniques and ingredients or seasonings that they may not be familiar with. Frequently, these Healthy Teaching Kitchen demonstrations are offered to participants in the MOVE program. Veterans watch the demonstration, ask questions, and if the class is held in person, can sample the dishes made. They're provided with copies of the recipes to take home with them so they can recreate the foods on their own. Currently, as we are still following COVID precautions, Healthy Teaching Kitchens are being done by video. While they're unable to sample the foods prepared, veterans are able to observe the techniques and ask questions during the demonstrations. Our veterans love these Healthy Teaching Kitchen programs, and we love the opportunity to teach and support such a vital and rewarding skill as preparing a simple, nourishing, and healthy meal. Food is what supports us all, and as March is National Nutrition Month, we value the opportunity to share what good nutrition can do for everyone. Eat well and be healthy.
Well, wow, that was a great presentation, Lisa. As she mentioned, it is National Nutrition Month here in March, and that's one of the reasons why we're doing this webinar right now. It's our hope that veterans will make a better and more healthy choices when it comes to their diet, also adopting a more active lifestyle I, as one of the beneficiaries of VA healthcare, am currently enrolled in the MOVE program, and it is a great program that I'm sure we can learn a little bit more about as we go into the Q&A session. And that's what we're going to do right now. We're going to go ahead and take some time now to answer questions we received through the chat pane. We received a few already, but please remember, if you have a question and you haven't asked it yet, feel free to ask that question by typing it into the chat pane. We'll get to it as soon as we can within the time remaining. Again, if we don't get to your question, please know we still want to answer it. We will give you a way to contact us at the end of this presentation. Also, I see that there's still folks coming into the presentation. Don't worry, we're going to be sending you a link so that you can watch the presentation in its entirety. So we have with us live this evening Lisa Sharp Gomez, who is a registered dietitian, nutritionist, and licensed dietitian. She is an Air Force brat who settled in the Dayton area in the late 70s. She has been married to her Army veteran husband for 35 years and has raised 4 beautiful daughters. Lisa graduated from Miami University of Ohio in 2014 with a BS in nutrition and completed a dietetic internship through Andrews University in 2015. She has been a registered dietitian nutritionist for 6 years, and she's been with the Dayton VA for 5 years, working both in the inpatient and outpatient setting, including meeting with veterans in their home as a home-based primary care dietitian. Currently, she meets with veterans in the outpatient clinic as a PAC team dietitian. Also, Lisa is trying to train a very stubborn Shih Tzu named Dexter. So, Lisa, tell us a little bit about Dexter before we get into the nutrition programs.
Yeah, so Dexter's 10, so I'm not really sure who's training who, but we've come to a mutual agreement that he will get a treat every time he comes in from going out in the backyard. Some small victories, right?
Small victories, absolutely. And I wish you guys gave me a treat every time I succeeded on the MOVE program, but I guess losing a few pounds and gaining some more energy is enough of a treat. I should be very happy with that.
Well, I will applaud anybody who completes the MOVE program.
Well, I haven't completed yet. I've recently started, and I think I'm into week 6 now. So we're moving forward. Again, I'm your host, Scott Leese, with the Medical Center's Community Outreach Office. I am an Air Force veteran and will be happy to answer any questions you might have about the Dayton VA Medical Center in general. Let's see what questions you have. I see that there's a few in the queue already. So Jack wants to know, how do I make an appointment to see a dietitian? Lisa, can you answer that?
I sure can. So Jack, there are 2 ways that you can make an appointment. The first one is that, your primary care provider can place a consult. And then when the dietitian gets that consult, we'll have our scheduler contact you to schedule an appointment at a time that's going to be best for you. The other way is you don't have to have a consult. You can call the scheduler directly whenever you would like to get some information from a dietitian. And you can reach us at 937-268-6511, extension 1001. So you can schedule an appointment whenever is convenient for you.
All right, terrific. Next up, we have a question from Chip. He says, I was denied VA health care when I retired due to my income. Would I be eligible for any of these wellness programs, Cleveland area? Thanks. Actually, here's what we need to do, Chip, is when you never know when eligibility is going to come available to you, especially if you're talking about based on income, if you've retired, if your income changes, etc. We can always reevaluate that. And the best thing to do is contact the eligibility and enrollment office. That goes for anybody who may have been denied in the past for whatever reason. We encourage them to stay in contact with enrollment and eligibility and work with them to see if we can actually have you start receiving that care and those benefits. Angela would like to know, how do I watch the cooking video? Sorry, I missed it. So I will say that we're going to go ahead and send out this webinar in its entirety. We'll send you a video link so you can rewatch this. But tell us, Lisa, are there some video out there? I believe there's some videos on cooking videos, correct?
Correct. If you go to the VA Healthy if you go to YouTube, you can search for VA Healthy Teaching Kitchen, and there are many, many, many very educational videos, and some of those recipes look pretty tasty. So check that out.
Yes, they do. I think we actually put some information out today in our veteran newsletter about where you can go get some of those with our new VA healthy cooking tips, actually. So we also have a question from Angela. I am very familiar with YouTube. Thank you. Okay, so she just said, I guess you can get some of them out there on YouTube. Mm-hmm. Ray lives in Cleveland, and he would like to know if he qualifies for the MOVE program. And I would assume that he's asking because he lives in Cleveland as opposed to here in Dayton.
Yeah, so if I can answer that, and if Ray is enrolled at the VA in Cleveland, the Cleveland VA most definitely has a MOVE program. So you can, call, I would just call the general VA number for the Cleveland VA and ask to be connected to the MOVE program.
Okay. Lanny would like to know, is this seminar for the Dayton VA only? Well, I think Lisa just kind of answered that question. Yes, this is the Dayton VA's webinar, but a lot of the programs, I think all the programs that we talked about pretty much are in fact VA-wide programs, correct, Lisa?
Correct.
Okay.
Yeah, the MOVE program is most definitely VA-wide. The Telemove program is VA-wide. So yeah, whatever VA you have enrolled in, you can make use of these programs.
Okay. Lanny is asking, is the MOVE program offered at the Middletown facility? I'm assuming she means the CBOC.
So Lanny, I guess that's where you receive your care, and in the future, hopefully the near future, we will be having in-person MOVE classes at the Middletown CBOC. Currently, right now, all of our MOVE classes are done by video. So if you call 268-6511 extension 1699, that is the MOVE scheduler, and she would be, happy to get you scheduled into one of those classes once you're enrolled with the VA.
Okay, fantastic. Again, I want to remind everyone, if you have a question, feel free to enter in the chat pane. We're going to go through these questions as quickly as we can and hopefully answer everyone's question. Next question up is from Paul. Paul is wanting to know, is there a database to view previous kitchen videos?
Oh, and Paul, that would be on the YouTube. Go to YouTube and search for VA Healthy Teaching Kitchen, and there are lots of cooking videos. So spend some time enjoying those.
Okay. Kim is asking about COVID-19 restrictions. She wants to know, are there still restrictions for coming in for an appointment? Actually, I can answer that question. There are not restrictions for coming into an appointment, but to enter the facility, we are still asking everyone to wear a mask. This is a medical center. People with illnesses are of course, coming to a medical center, and we want to make sure that we're protecting not just the people that are there, but you as well as patients coming in to make sure that you are taking every precaution so not to either spread or receive any infection while there. Though that having been said, if you have an issue with coming into the facility for whatever reason, as Lisa said, there's also options to do many of these programs remotely or virtually, correct, Lisa?
Yes. Yeah, so you're speaking about the meetings with the dietitian or the MOVE program? Most definitely those can be done either from the CBOX, they can be done by video, they can be done by phone, they can be done in person. So we have lots of options.
Great. Steve would like to know, how flexible is the MOVE program schedule? I have travel commitments that would interrupt the flow of 16 weeks of the program.
Yeah. So the research shows us that if a person attends 12 sessions, they're getting a lot of benefit. The MOVE program is 16 sessions. We're not you don't get dinged if you miss a session. So because we understand that we're grown-ups and we have things to do. The fact that we're doing it by video right now does also give you some options because you can technically connect from anywhere in the country. If you miss a lot of sessions, you can enroll in the next MOVE cohort, so you can kind of make up some of those classes that you missed.
Great. So I would ask you myself, Steve's talked about flexibility. Yes, it's very flexible, but at the same time, we're also talking about some lifestyle changes too. So you probably want to make that commitment, right, Lisa? That you're actually the MOVE program is very big on actually changing your diet and what options you choose.
Right. So the MOVE program helps those veterans that have enrolled to set goals, to achieve better health, to achieve that weight loss. We would love it if you came to every class, but we certainly understand if you're not able to. And we would hope that if you are unable to attend a class, that you're still able to kind of remember those goals and try to meet those, in between sessions.
All right, fantastic. So Mary is asking, how long will I have to wait to get an appointment?
Okay, so Mary, I'm guessing that you mean an appointment with one of the outpatient dietitians. So our goal is to schedule an appointment as soon as possible after we've received your call. Usually, usually it's within 2 weeks we can get you in. There are times, just based on the type of appointment that you want or the availability, we may even be able to get you in the next day. But usually it's within 2 weeks.
All right. John wants to know what is BAM. He'd like you to explain that again.
I'm sorry, say that again, please.
John wants to know what is BAM. Could you expound on that?
Oh, BAM. BAM stands for Be Active and Move. So it is a program that is aimed at veterans who want to increase their level of physical activity. They are, again, they're classes right now that we're doing by video. So you have an instructor, he's leading you through these exercises. I believe there is a requirement for you to attend 5 MOVE sessions before you can enroll in the Be Active and Move program. But it is led by an exercise physiologist who is going to help you exercise safely.
All right, super. Jerry is asking, can I bring someone with me to an appointment?
Oh, Jerry, absolutely. So many times the family or the caregiver is providing a lot of support, whether you're trying to lose weight, whether you're trying to make some good, healthy diet changes. And bringing a family member with you can be a great way for them to learn what's important for you. We do ask, because our offices are not that big, that you bring one, not more than 2 family members with you. Don't bring your whole extended family to the appointment, no matter how important it is, because we just don't have room for everybody. But most definitely, bring a family member, bring a caregiver, bring a friend, whoever's going to provide you some support with whatever your goals are. You can also bring a family member with you to the MOVE program. So when we're doing the MOVE program by video, it's no problem. You can have, your caregiver, your friend, your family member sitting right with you. When we're doing them in person, I would encourage you to check first to see how many people are enrolled in the class, just to make sure there's enough seats for everybody. But most definitely, I want, bring your family member. That's great.
We can always use more support, right?
That's exactly right.
And actually bringing those family members or a friend actually is probably a great thing, because that they're learning alongside you and might be able to support you in your efforts to
And they can help
become
you
more
be
active, become healthy.
yeah, they can help you be a little bit more accountable too, because they heard the same thing, so you can't fool them.
Speaking of accountability, that kind of reminds me of another word, competition. Is there any competition in this?
There is no supported competition. We're not encouraging people to compete with each other, but there most definitely is in class.
Great. Okay. So those of you who are competitive A-type personalities, this might be just the thing for you. Get in that class and see if you can compete with your fellow classmates. Frank wants some clarification. He says, I've heard the term medical nutrition therapy. What does that mean?
Okay, so medical nutrition therapy is what we as dietitians practice, and this involves assessing your health, assessing the condition of your health, and providing some education based on your medical diagnosis, your condition, your individual needs. And then we would recommend interventions, diet changes that would improve your health. And these are, evidence-based recommendations. So anybody can go out on the internet and post whatever they want. They can tell you that eating 5 pounds of broccoli a day is going to be good for you. But as a dietitian, we are doing the research. We are using evidence-based approaches to help you be as healthy as you can be. So, if a veteran came in and was wanting to manage their blood pressure, we would spend some time finding out about their diet, about their shopping habits, about their lifestyle, and we would then provide them some education on what it means to eat a heart healthy diet, what it means to eat a lower sodium diet, what that looks like. So again, we're providing that evidence-based education to help people, achieve their health goals.
Okay, Alice would like to know, how many times can I see a dietitian?
You can see the dietitian as often as needed until your goals are met. If you come into my office and you say, I want to lower my blood sugar, we're going to work with that. And I'm going to give you the education, and you're going to make the changes that you need to make. And once you've achieved your goal and you feel comfortable with the knowledge that you've gained, then you can go on your way. If you'd like to come back and see me again, you can come back and see me as many times as you need to make sure that you are meeting your goals, that your goals have been met.
Mark says, I live too far away to come to an appointment. How can I see a dietitian?
Oh, that's a good question, Mark, because many people do live far away. And that's the nice thing about having the community-based outpatient clinics. Many of those are closer than the Dayton VA, so certainly you can receive your care there. Appointments with a dietitian can be done by video, they can be done by phone, or they can be done at the CBOC if you're not able to drive all the way to Dayton. So we do have ways to provide you care without having to come here.
And I would actually piggyback on that, Lisa, and say there are also transportation programs to the VA's facilities. There are opportunities through either your county veteran service organizations, but also the VA has travel compensation and other ways to get you to and from your medical facilities. Once you get enrolled, you can talk to the transportation office, and they will be glad to assist you with transportation to and from. But again, like Lisa said, there's a lot of different options to receive that care, to get the transportation through the VA, to find the facilities near you, such as a community-based outpatient clinic or CBOC, as well as the virtual options that are out there. So we hope that everyone realizes that There aren't too many places that you're going to get that kind of care, and people working that hard to ensure that you get that care like the VA does. So Joe is asking, are there any special requirements for the MOVE program?
So the MOVE program is open to any veteran that is overweight or obese, with special consideration given to those who also have some coexisting conditions. So if you are overweight and you are diabetic, that would be a great fit for you. If you are overweight and if you're considered obese and you have high blood pressure, you know, or high cholesterol, the MOVE program would be a great fit for you. So really the basic requirement is that you are either in the overweight or obese category. And certainly that is something that you can find out, you know, from your provider. There are calculators, there are body mass index calculators available online. So you can put in your height and your weight and it will tell you what your BMI is. So anybody with a BMI over 25 is considered overweight. So that's really the only special requirements.
So it does not require a physician's referral.
The MOVE program does not require a physician's referral. The telemove program does.
Okay.
So that's the difference. That's the difference between the two. The video or in-person MOVE program does not require a referral, but the telemove program, which is the 90-day program where you interact with the phone, that does require a consult.
Okay, terrific. Darlene is asking, is there a separate MOVE program for men and women?
Ooh, at this time, Darlene, there is not. Our programs are designed for both men and women. They are co-ed at this time. And as far as I know, at this time, there are no plans to have separate classes for men and women.
Okay. Greg wants to know, does the VA collaborate with the YMC Golden Sneakers program?
We do not.
Okay. And so Angela would like to know, do veterans get a discount at the cafeteria at the Dayton VA hospital?
Can you answer that question?
I believe no, they don't. I do know that the canteen there actually has a reasonable prices. It's not just the veterans, but just about everybody in the facility uses it and really likes it. But I don't know of any particular discounts that they offer to veterans. It's geared to be an affordable option for you. I will say that there are times, say you get an appointment where you've been fasting, for example, they will give you a voucher for so much money. If you're coming in for blood work to be done and you've been fasting, they'll actually give you a voucher for a free meal so that you don't walk away faint. But I'm not even positive of all those different options, but you can also feel free to contact us later on, and we'll do some more research if you're more curious about that. Judy wants some advice on what's the best way to know if I qualify for this care. And I would assume she's actually talking about VA healthcare. Again, I would reiterate that it's really your best thing to do is to go talk to the folks at enrollment and eligibility. We do have that contact information for you. We'll be giving that to you later on. And I believe we are actually coming to the end of our questions, unless anybody else throws a question in here real quick. Here we go. Tim is asking, is there any resources for diabetic specific nutrition, i.e. recipes, videos, etc.?
So, Tim, if you are enrolled at the VA, we do have a lot of educational material available. There are diabetes education classes. There is the diabetes self-management education class series. If you want to go out and do the research on your own, the American Diabetes Association website has a lot of great information and lots of recipes. So that would be my suggestion, would be to go look at the American Diabetes Association to get some good tested recipes.
Okay, well, I think we've exhausted all the questions that have come in so far, Lisa. I want to thank you very much for doing such a great job of fielding those questions. We're actually going to wrap up this evening if I don't see any other questions here in a couple of seconds, but we hope everyone has found this event both helpful and informative. If we didn't get to your question, not to worry, or if you have a specific question that you didn't want to share with everyone else, we're going to give you a number right now as to how to reach out to us and ask those questions. But we'll be glad to get back with you as soon as we can. So if you wanted to reach out to us, again, that number is 937-268-6511, extension 2035, or extension 2159. Again, that's numbers 937-268-6511, extension 2035, or extension 2159. Or you can again call our eligibility and enrollment office at 937-268-6511, extension 4105, numbers 4105 for questions about how to enroll with the Dayton VA. Again, there are several options for enrolling with the Dayton VA Medical Center. If you are not currently enrolled but would like to enroll with the Dayton VA, here's how you can do it. First, in person at the Dayton VA. They will be glad to answer any questions you have at the enrollment and eligibility office there. You can also go online to www.va.gov, and there is the information there. Also, the National Call Center. And Greg, can we get that slide for those numbers? Here we go. Yeah, the National Call Center number is 877-222-8387, or mail in a VA 1010 to the Dayton VA at 4100 West 3rd Street, Dayton, Ohio. There is also the community-based outpatient clinics, the CBOCs. There are their phone numbers. You can call them, and they would be glad to schedule an appointment with you. Again, call them and they will tell you what documents you need to bring in to ensure that we can determine your eligibility. And we hope we've answered all your questions this evening, especially about the things that we are doing for our veterans' nutrition and how to get them more active and lead a happier, healthier lifestyle. Thanks again to our panelist, Lisa, for all the great information she has shared with us this evening.
Yeah, thank you. It was a pleasure.
And thanks again to everyone who has attended this event this evening. Have a great rest of your evening, and thanks to all our veterans for the service to a grateful nation. We'll go ahead and leave that slide up there for you so you can get those phone numbers.